What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
Good. Today I'm excited about this topic, phases of healing. This is something that I think all healthcare providers and even lay people need to understand
Yeah,
and see how
absolutely.
fast they heal and how fast they can recover.
Absolutely. So we do know that in phases of healing, the body is going to generally follow a predictable series of overlapping events to help heal the body. But in that same vein, we do understand this process well, and we don't understand this process well. So there's a
Yeah.
ton of things that go into this. And initially, I was actually going to try and make this podcast on phases of healing for different types of injuries, but that's just way too much because everything is dictated by the environment that it's in. You know, the
Right.
cells change if it's a bone versus you step on a knife, that sort of thing.
Right.
So we're talking all things healing just in general, and we're mainly going to focus on that immediate time or those first, we'll say the first year or so, with these types with injuries today. So
Okay.
what are these phases of healing or these stages of healing? They take different names, but there's three that we're really going to focus on, and then we're going to use some names interchangeably to kind of talk about them and better understand them. So the primary deciding factor for the healing time is time frame. Now, if we could get in there and see what's going on at the histological level, or we could see what's going on at the cell level, that would certainly help dictate which phase we're in a little bit more. But
hmm
generally, as clinicians, that healing time is our guideline.
And what do you mean by that healing time? Like just the time that it takes to completely heal, from the time of the injury to the time you heal.
Yeah, and I guess what I should say is that around the injury, essentially. So we're going to start right from that injury and then
Okay.
go to the remodeling phase, which I'll talk about. But towards that latter portion where we're returning to function, and yeah, if it was a cut, that scar is healed up, and you no
Right.
longer have a scab or that sort of thing.
Okay.
But yeah, the primary deciding factor of which one of these categories you fall into is generally just the time frame from the
Okay.
injury. So
Okay.
the inflammatory healing, there's proliferation phase, and then the remodeling. So you have inflammatory phase, proliferation phase, and the remodeling phase. That inflammatory phase is also known as the acute stage of healing or coagulation. And this is where you have that initial onset of injury. So you're talking 0 to 14 days, 0 to 7 days, depending on what type of tissue it is and how quickly it clears out. But you're talking that very, very initial response to injury.
What's defined as an acute injury then? So an acute injury could be anywhere from a few days to a week or so.
Yeah. And yeah, exactly. So the immediate time after the injury to 3, 4, 5, 6, 7 days after. And again, it has to be this wide of a window for the sake of the discussion now. You know, if we're talking your paper cut, maybe that inflammatory phase is a 24-hour period. If we're
Right.
talking you break your bone and all that sort of stuff, it may be a 5, 6, 7, 8, 9, 10, 11, 12 day
Yeah,
period.
it's interesting to me because in medical school it was like this defining line, which is not. There's never a defining line. The body, just based on the way you injure something and where you injure it and the environment and all that, the acute phase kind of has this moving goalpost. But it used to be, they used to say, well, 3 days, that's acute. And then after 3 days is considered chronic.
Yeah.
It's like their guideline, which we know when you have hard, fast rules like that, they're never completely true.
Well, and we even see it in
They
the
don't fit reality.
right, right, and we see it in the definition that what I read of the body attempts to heal itself through a predictable series of overlapping events
Right.
is straight from the textbook. So
Yeah.
these events are overlapping, and there's a constant overlapping of these events. And part of what we do as a physical therapist is ensure that you're not overlapping these events negatively, like in a way that you would build up scar tissue formation that could possibly limit your range of motion or that sort of thing.
Right. Right.
So in that inflammatory phase, also known as the acute stage of healing or also coagulation. So again, large variety of names for all these terms. But you're going to see initially vasoconstriction that's going to turn into vasodilation, and you're talking 10, 15 minutes after the injury here. So that vasodilation happens for a variety of reasons. You have a kinin cascade, which are essentially a bunch of cells that help make the tissue membrane more permeable, and it ends up swelling and things pass and come and go a lot more. In that inflammatory phase, you have a lot of things coming and going, and macrophages there to clear it out, fibroblasts there to essentially help start the healing process. You got a lot of things coming, but the big thing is you get that swelling, that redness, that pain from this influx of all these cell mediators or all these biological mediators. So you have that
Which is
initial.
actually a good thing unless it goes on too long, right?
Exactly.
Or you get this an overabundance of this cascade where you start where it actually starts injuring the tissue. But for the most part, this is a natural thing that helps the healing process.
Absolutely. And you have the main function of this cell-rich response is to provide cells the necessary biological components for redirecting reconstruction, or for directing reconstruction of damaged tissues and cleaning out that area. So this is where you have the insult. And again, it really depends. Imagine if you stepped on, an infected nail versus you tear your ACL. They look very different, but they also look very similar.
Yeah.
And so that's just important to know as we go through this. And so what is that initial response to tissue injury? You're going to have a release of intracellular material. So within the cell, you have a bunch of things coming in, and they come out of that extracellular space because we now have or they come out into the extracellular space because we now have that increased permeability. So things can come and go through the tissue easier because we have an increased permeability. That's caused by histamine, serotonin, and as well as just that kinin cascade that I talked about increase that permeability. This concentration of cells now in this area and the proteins in the wound helps increase the healing capacity and bring all these good things there. And then prostaglandin, PGs, we'll call them, are synthesized by the cells in the wound, and they attract white blood cells, and this may control that early late reparative process. So that's in that immediate 24 hours following injury. You have all these different types of cells come in, whether they be white blood cells or things to start actually laying collagen, and clear macrophages start clearing out the damaged tissue, and all that's happening within that first 24 hours or so. This is the immediate response to injury. And then at that point, in that acute phase, what are you going to see? Well, you're going to see redness, swelling, heat, and pain at that point. Is typically what you see at that point.
Right.
And so then we'll move. Go ahead.
I'm just during that acute phase, like just to make sure it doesn't go out of bounds or the swelling gets overabundant or too much, that acute phase. So to prevent damaged tissue, that's where you see that whole, depending on the injury, again, we're talking about, but that's where you see that whole, ice and compression, the rice type of thing, right?
Yeah. And especially once you get towards, so you have that initial vasoconstriction and then that vasodilation. And it's at that point where you have that vasodilation for a little bit of time that you would want to use that ice and help quell that area back down. Because we've mentioned it before on the podcast, Keoni, where
you're right.
To some degree, you want this process to go down. This is a good thing for you.
Yep.
As long as it doesn't run unchecked, like you're alluding to. But then, so we move to the proliferation phase. So now we're 2 weeks, we're 7 days to 2 weeks to 2 months outside this injury. And you can see I've got to give these wide ranges of time. But that proliferation healing, also known as the subacute stage of healing, and I've also heard it be referred to as the controlled motion phase of healing. So you can start to kind of see what type of interventions we would do at this point for someone. So in that subacute phase, the overall goal here is to promote the healing of the tissue, restore joint mobility, and progressively strengthen and protect it. So
what is the person actually feeling during this? They obviously are starting to feel better, right? Like it's not as, I don't know, if they had restricted range of motion in a joint that's been traumatized, they actually maybe can start moving it a little bit. That type of thing.
So in PT school, we kind of broke these phases of healing down versus a stage of condition, and a stage of condition being how does the person present, more or less, like as a full image. And then the phase of healing would be kind of what I'm running through. So the way we broke down the stage of condition versus the phase of healing in these two, so specifically the inflammatory and the proliferation, would be acute, which would be inflammatory, is getting worse, Whereas the remodeling phase or this subacute phase, the person's actually getting better at this point.
Okay.
So when you when you ask the patient, do you feel it as and again, I know for people, and I was this way, where it's almost annoying, some of the questions. It's like, do you feel like this is getting worse or better? That helps tell us where you could be along this path.
Right.
And some of those other things that can help kind of discern between those two stages, Keoni, of what the person's feeling is they're probably not having the redness. There's probably no an active inflammatory process, but there could be, and it could be lessened.
Right.
And so again, this is where we kind of get that blurred line between the two.
Right. Okay.
But we use these things to help guide us. So in the acute phase and that inflammatory phase, the person's probably in a fair amount of pain. Even without moving, they may be in pain. And then in that subacute phase, overall, the pain's decreasing. So again, these are just general things that we can use. The function would be improving in that subacute phase. So maybe if we think of an ACL, when you tear your ACL, you have a large amount of swelling in the knee. That large amount of swelling in the knee can impact your quads being able to fire and function and limit your knee range of motion. Yeah, so if we start to see that swelling go down and that the improved range of motion, we're thinking, okay, acute to subacute.
Right.
And the person at that point, what's actually happening at the tissue level, you're having capillary growth. So basically little nerve or blood vessels and granulation tissue formation, fibroblast proliferation, and with collagen synthesis, an increase in the macrophage, which are the cells that eat bad tissue and just eat things we don't want.
Kind of clearing out the cellular debris there.
Perfect. Yeah.
So healing, and then clearing out the debris. So bringing in the good stuff, take out the bad stuff. We talked about this, right? Where sometimes you can enhance this along by doing the contrast, the cold and hot.
Absolutely. Yep. And it's exactly what you said. At this phase, you're bringing in the good stuff and still clearing out the bad stuff. And here's where you want to be real careful about ensuring that you don't get stuck in a cyclical remodeling phase where you're constantly bringing in the good stuff. It's not necessarily getting laid down well. The macrophages are clearing it out, and you end up with this cyclical cycle of being in this remodeling phase.
Right. And one of the things I find with my patients with this is that they start feeling better and they go out and start traumatizing again, like in some sort of way.
Exactly.
Right.
So this is where your key focus at this point, definitely in the acute phase or that inflammatory phase, you're definitely protecting yourself and protecting the injury, but it's going to be a lot easier because you're going to be in pain. But like you just mentioned, Keoni, at the proliferation phase or this subacute phase is where, I think I feel better. I think I can go back to water skiing. And then the tissue is not actually fully healed in any way.
Right.
And just actually, while we're there, as far as tissues regaining their strength. So we're talking about the epithelium layer, just because we got to break something down, which just means your outer skin layer. So where you would get a scab. 3 to 4 weeks after injury, Keoni, that's only at 25% of its pre-injury strength, that tissue.
Yeah, wow.
And then at 70 to 80% of its strength, 7+ or several months later. So it's extremely important to continue applying controlled stresses to the tissue long after healing has appeared to occur.
So what do you mean by controlled stresses? Like exercises in a way that doesn't re-damage it?
So when we think about something like an ACL, what does the ACL do? It limits that translation of the tibia anteriorly. And so we want to slow, this definitely isn't the first week of physical therapy where we're slowly giving you those anterior stresses. But eventually you should be able to do that same level of anterior stress, if not more, that caused the injury. So let's say something like a lunge where it could place a lot of anterior shear and stress on the tibia. You would slowly just grade those up. And that's something that speaks to what you were just saying about properly managing that phase and just being aware 3 to 4 weeks out, you're at a quarter of the strength that tissue was previously at. So you have to respect these times.
Right. And at 3 to 4 weeks out, you're probably feeling pretty darn good mostly. So you feel like you can go back to what you need to. Yeah. Mm-hmm. Yeah. I think this is so. Am I correct in saying this is the phase where people tend to re-injure themselves? It sounds like the potential is there.
As far as what I've seen, as far as an injury that was either healed or surgically repaired and then was further injured in
Yeah.
inactivity. This is the phase you see it. Yeah. This is
Yeah.
when
So
the
you don't want to go on what your brain tells you, right? Like if you,
yeah.
if your brain's telling you you're feeling good, it may not be quite true according to your physical body.
And it's tricky because I mean, there was a UFC fighter Keoni this year who he tore like his LCL apparently off the bone. Who knows? But he had a serious
Yeah.
knee injury, and he came back and fought in like 6 months. And he
Yeah.
got kicked straight in the knee and that sort of thing, and you could tell that it was bothering him. But he was
Right.
able to fight and do it. And so there's so many factors that play a role into your healing time, whether it be nutrition, your activity before, how strong you were before, all that kind of stuff.
Age is a big one.
And age is huge. We're going to talk about
Yeah.
that. But it's all, um, you do have to respect the healing times. I mean,
Yeah.
they take time.
And
But
everybody's different. Everybody's
everyone is
different,
different.
you know?
Everyone is different. Okay, so that's the subacute or the proliferation phase. At that point, we're bringing out the bad, we're bringing in more good, and we're hoping to lay down positive, good, healthy tissue. And
Right.
then the chronic phase, or known as the remodeling phase, or the also return to function phase. This is any time after a month to 2 months to all the way to a year plus. So this is that returning to function phase. Here we're converting that healing that healing tissue to scar tissue. Fibroblasts help handle the synthesis and deposition and remodeling of the extracellular matrix, the collagen. Basically, they're helping clear and remodel good, healthy area around them that was
Right.
previously injured, and bring it back to its former level of what it looked like the orientation
Mm-hmm.
of the fibers, all that sort of stuff. And so here, here you can begin to work on returning to function more or less. The goal is to decrease pain, increase mobility, strengthen, and develop the balance of muscular endurance and progress back to whatever functional activity the person's particularly interested in.
So
So
here we're talking about specific exercises that you can do to help strengthen and
yeah,
um,
now it just looks a lot more functional. Whereas maybe in that subacute phase, you're going to be doing, some gentle exercise. Maybe you are doing a little bit of strengthening. We'll stay on that ACL example of that leg. And then in that
mhm.
chronic phase, that's where, let's say it's a soccer player, for example, as well. That's where you begin to kick a soccer ball, or you begin to work
Gotcha.
on planting your one foot and swinging through and that sort of thing, functional type movements.
Mm-hmm.
That's where that's really going to come into play. So the overall, I'm just going to run through the goals of like a physical therapist at these three phases: the
Yeah,
acute,
I was just going to
subacute, and
ask you
chronic.
about that. Okay.
So in acute, this is where the person has the most pain. So now we're working on controlling the pain, manage the mobility, reduce the swelling, and educate the patient on protecting the injured tissue, of course, and doing things like ice, maybe an anti-inflammatory, that sort of thing. The biggest thing about being in this acute phase, and again, we're talking the moment after injury to possibly 14 days. I would say more like a week, if that. But here we're in that acute phase. We don't want to increase anything. So when you think of whatever you're doing to help, this isn't where we're like loading up any weight. This isn't where we're
Right.
improving range of motion. This is our goal is not to see an increase in anything in this phase. Our goal would be more so to see a decrease in swelling, a decrease in pain, a decrease in all these negative things that are coming about because of the immediate injury.
And this may be up to 2 to 3 weeks, right? This phase.
Yeah. General, yeah. Immediate injury to 2 or 3 weeks or so. And so here, as a physical therapist or at home, what you can begin to do is just gentle, passive movements, specifically in a pain-free range. So if it doesn't hurt in a specific way and you can move it gently that way, you can do that. There's also a thing we do called muscle setting, which is basically just a low-level isometric contraction below the injury and more or less just helps pump blood. So if you have an ACL tear, and you think about, lifting your toes towards your nose constantly and contracting those muscles that lift your feet, you're essentially helping pump blood through that knee joint that has a lot of inflammation and edema at that point. So you can help clear some of that out with this kind of muscle pumping or muscle setting.
Right. Okay.
And then we're going to move. And so again, the biggest thing at this point, we're not increasing anything. We're just facilitating the healing, and we're trying to quell all those negative things that come about from the inflammatory process, like the redness, the swelling, the pain, the loss of motion. Then moving on to the subacute phase. So next, just again, subacute phase, AKA proliferation. And now we're 2 weeks to 2 months into this process. The goal again is to promote that healing, restore joint mobility, and progressively strengthen again. So now you can do active assisted range of motion, which basically means if I was going to lift my arm up, I'm going to use my other arm to help it get there. Active assisted.
I got you. Yeah.
And then you can do active exercises as well. So once that becomes easy, you can just move your own arm. Eccentrics, they load a tissue quite a bit. So these aren't going to be great in the beginning, but they're going to be good towards the end of this phase. And eccentric is that slow, controlled lowering. So if we're doing a pull-up, once I'm up above the bar and my chin is above the bar and I'm slowly letting gravity pull me down, that would be an eccentric.
Yeah, there's a lot of research on eccentric promoting healing and helping regain strength back.
Yeah, so it's
eccentric phases of lifting.
Super useful in those later phases of this healing process because they allow us to lay that collagen down in a nice organized fashion, which is how your muscle or tissue was before the injury.
Right.
And we see not such great organization, specifically following like immobilization and things like that, which I'll talk about. But eccentrics are going to be great later on. And then it's good at this point to utilize a closed kinetic chain. And a closed kinetic chain just means, think of exercises like a push-up or a squat where your feet or your hands are flat on a surface. So you have contact point, whether it be the ground. So an open kinetic chain exercise would be a bicep curl. A closed kinetic chain exercise would be a push-up. So you can kind of see how one can freely move and one is not at a fixed
One's
point.
more stable, yeah.
You want to utilize these closed kinetic chain exercises in the beginning phase of your healing because they provide a little bit more stability. So you get that co-contraction. Let's again stick with the ACL example. If I squat down, now my ham, so we know after an ACL example, like I was saying, you have a lot of swelling in your knee. That level of swelling can inhibit the quads from working as well as they should. So right. If you do a squat, your quads maybe they're not going to heal, they're not going to be able to perform as well as they need to. You can take some of their demand off by doing a closed kinetic chain squat, and you'll use some of those hamstrings as well, versus like the machine where you just the leg extension machine. Right. That wouldn't be as great in this point. And then the last phase, that chronic phase, we really want to decrease pain if they still have it, increase mobility, strengthen and develop muscular endurance and balance, and progress towards functional independence. So now it's really what does it look like that you want to get back to, and that's what we're doing. At this point, you can utilize all sorts of complex activities or intensities, make the exercises more functional, unpredictable, endurance oriented, that sort of thing, and work on flexibility and all that good stuff. So at that chronic phase, if we're talking about the stage of condition, what the patient looks like, they have continued complaints beyond perceived healing, but there's no redness, no swelling, no warmth. All that stuff is kind of unlikely, but now we're beginning to think about, why does this person still have pain? If they do have pain, and how do we just get them back towards full function? Yeah. And so that's really just a primer on the stages of healing, those 3 phases, and kind of what you can do in those 3 phases for yourself and properly manage it. The biggest thing would be in that inflammatory stage, that initial time after healing. We're certainly not increasing anything, and we're working on calming down and feeling better. When we move to that second stage, that proliferation stage or that subacute stage, we're slowly working on facilitating the healing, controlling the motion, which is going to help facilitate the healing. It's going to tell the collagen how to be laid down. It's going to tell the tissues how to respond. So we're going from doing, let's just be a little bit more palliative. Let's take care of the pain, the redness, all that sort of stuff. In that proliferation phase, we move on to let's facilitate this healing properly. And in that remodeling phase, it's how do I get back to skateboarding? And it's that 1, 2, 3 step process all the way through to whatever the function is that you want to go back to.
Yeah, with these stages of healing, I mean, I could tell you the way I as naturopaths kind of go at it, or even primary care physicians is, you know, you want to help decrease the pain, especially in that acute phase, um, by whatever means you can. For me, I usually recommend, because it's not going to inhibit healing at all, whereas the NSAIDs would. I usually recommend some type of herbal anti-inflammatory. That way, it doesn't it, it enhances the healing instead of breaking down collagen even more, like chronic NSAID use would be, that
Yeah.
type of thing. So if you can minimize that and go to the something like curcumin or boswellia, or maybe ginger, you're thinking about maybe piperine and pepper, or cayenne, just any of the herbal anti-inflammatories, certainly can help. And then, one thing and then in that, I guess the subacute phase, we talked about hydrotherapy a little bit, right? Hot, cold can certainly
Yeah.
help. And now, this is just stuff that I do. I mean, I'm not even talking about any of the PT stuff, which
Yeah.
is, I think is foundational, but hot, cold. And then you may want to think about using things that support healing. So that would be things like glucosamine, sulfate, glucosaminoglycans. You can take these all in the supplement, uh, along with like hydrotherapy, and making sure that you're doing appropriate exercise.
Yeah.
Um,
And we did the podcast on cryotherapy, but at this point,
oh yeah,
so you would do your immediate turn, basically that you can notice that there's like a halfway point in that proliferation phase. There's three
yeah,
phases that I've been talking about, but there's essentially four, where you have that inflammatory phase, you have the proliferation phase, part one, where you're still fragile or a
yeah.
little bit more fragile. And then in part two, where you can begin to do things like eccentrics and start loading the tissue. And I would say when you move into that part two is where you may investigate using heat. Because as long as you still have any active inflammatory process, you don't want to use heat.
Right.
But after, certainly, and we see with like chronic pain or chronic injuries or people who are really stuck in that remodeling phase, heat's super helpful at that point. So yeah,
Right.
you would definitely, that contrast is something that you could utilize for sure. And then that does cause that initial vasoconstriction and vasodilation, which is exactly what happens at the beginning of the injury.
Right. It's interesting because I have a lot of patients who will come to me and they'll complain, like, I still have pain, or I'm still uncomfortable from either a surgery or some type of injury, like 6 months to a year after.
Yeah.
It's just interesting. I mean, to me, it just seems like, depending on the injury, that can be normal,
Yep.
that it can take that long to heal, sometimes up to a year for
Yeah.
some surgeries that I've seen, where you're still feeling the residual effects of that.
Well, then it also goes to how well did you manage your recovery, because that we know, so there's a response to immobilization, and that response is, it's not typically always great. You're going to lose glycosaminoglycans, or GAG, which is specifically what you just mentioned, Keoni.
Right.
And what you should know about these is that they just bring water and mobility and ease of gliding to the area, and help the tissue basically move along those
Right.
GAGs. So they make a slick surface for you to move on. And we see with immobilization that you lose some of these GAGs, you increase cross-link fiber formation in the collagen. So you get some, you could call them adhesions, but essentially, if you imagine a sheet and how it's woven together, and you had one random string attached to another random string, that's more or less what you're getting with immobilization, because the tissue's just laid down haphazardly. You're not moving it. You're not telling it how to lay down or how this elbow is going to need to move. So it just comes in and starts laying down tissue.
Right. And that movement helps direct it, lay down in the right place.
Right. So you can get that poor orientation of newly deposited collagen, which is what we just talked about. And then you could also get a fatty fibrous infiltrate into the area that has swelling, and you're going to have general atrophy of the tissue. So if someone was immobilized and then they weren't properly remobilized after a serious injury, that could be why they still have some of these symptoms, or they still have pain in their elbow when they open it, is because they had a bunch of scar tissue build up from being, from the elbow being stuck in a 90-degree position for 6 months or whatever the case may be.
Yeah.
If they broke it.
And a lot of physicians, especially after surgery, don't even go over this, right? It's just like, stay off
Stay
of
off
it
of it for a week.
right. And
Yeah,
you know, and those are kind of like these blurry guidelines that really don't have a whole lot of meaning. So yeah, I would think that sometimes if it's really taken a long time to heal, it's probably because you're doing too much too fast, moving it when you shouldn't, or
the opposite, or you're
the
not doing
opposite,
anything.
or not doing anything,
And
right?
that immobilization has brought you to that point. And so I just went over what immobilization does. Exercise or mobilization increases the GAG in the connective tissue, those glycosaminoglycans. They break up those cross links. They improve the orientation of the collagen fibers in the connective tissue. And then you work on generally strengthening and hypertrophying all the types of tissues that at least can be hypertrophied. And you can definitely strengthen ligaments and things like that, according to Wolff's Law. So all those sorts of things, basically exercise is fully combating the negative effects of immobilization.
Yeah.
So yes, you may have, depending on what the injury is, you certainly could go under a period of immobilization, but it's important to remobilize as soon as possible. And
But in general, just to recap, like 3 to 14 days, inflammatory phase, acute phase, probably don't want to do a whole lot of movement there.
Right.
And then like 2 weeks to 2 months, now you're talking about maybe passive movement, maybe a little bit of pain-free movement. And then and that's 2 weeks to 2 months. So there's some guidelines there for people. And then the remodeling phase is where you actually get back to your sport or lifestyle event. So meaning that maybe if you were limping now, maybe you can try to start walking and not be on crutches or something like that. Right.
Yeah.
Like, yeah.
Yeah.
And that's anything greater than 1 or 2 months. That's the remodeling, the healing phase, a chronic stage of healing you talked about.
Yeah. If you're considering getting a surgery, one of the best things you could do is look up the surgical protocol for your surgery. So like if you're getting a total hip replacement, type in to Google physical therapy surgery protocol, total hip replacement, or that sort of thing. And it's going to show you specific markers that the surgeons have decided that they want you to hit by specific timeframes. You may hit those earlier or later, but that kind of tells you what type of thing that can help provide something to read with this podcast as far as help bringing it all together. You can kind of see what the doctors or surgeons are shooting for. And yeah, just to give a quick rehash like you did, Keoni, because everything was so, I had to do this podcast as just a breakdown of phases of healing as opposed to a specific tissue.
Yeah.
Just in general, like a ligament sprain, depending on how bad it is, could take 3 days to heal all the way to a year if it was a grade 3.
We need to do a podcast on that, like ligament strains, tendon strain, like all that stuff. We need to know. I mean, I would love to have a recap on that myself.
Yeah, absolutely. So I just want to give people general healing times before we do that of what they should expect with certain injuries. So if you have some muscle soreness, that shouldn't last any more from 2 to 3 days max. If you have a muscle strain, of course, all these things have different grades of how bad the strain could be. If it's not that bad, it could be 2 weeks. If it's real bad, it could be 6 months. I just went over the ligament sprain. A tendon could take anywhere between 3 to 6 months to fully heal. Again, all dependent on how bad the type of injury is.
That's just due to blood flow issues, right, around the tendon and just being mostly cartilage or collagen, I should say?
Yeah, it depends on where it is. I know that most of the injuries to a tendon are at the junction between the muscle and the tendon, and that area is not vascularized really well. So yeah.
Or the bone or the tendon. I always hear about like tendons, like the Achilles coming off the.
Yeah, if it were to avulse off the bone, certainly. Yeah, if it's rupturing, that's where you're certainly looking at a much longer
recovery, right?
Recovery time. And then bone, anywhere from 5 weeks to 6 months. Maybe some more after, not being at full strength at that time. Articular cartilage repair, 2 months to 2 years. Articular cartilage being the lining of your joints.
And that's obviously a blood flow issue too. Can't bring the good stuff in as well.
Yep. And so there we want a cyclical loading and unloading. So we want to bring those GAGs, those glycosaminoglycans that are so important for the joints. If we unload and load, we can bring those gags and begin to facilitate more lubricated joint.
And loading and unloading is like muscle contraction, weightlifting. You may think about if you can do it without pain free. Is that what you're talking about? Using the joint.
Yeah, think of walking.
Yeah.
That's a perfect example of loading and unloading the knee.
Yeah.
And then a ligament graft, 2 months to 2 years, if not more. But that just gives you general times based off some general type of injuries. But definitely this information can be useful, from paper cut to I stubbed my toe to ACL tear to as serious as it could get to after surgery. And you want to follow, you're still going to go through, like we said, it's a predictable series of overlapping events. That said, it's not always predictable based off the person's exact situation, but we do know, we have a good idea of what's happening, but there's definitely more room to learn.
It's great. Damn, I love this podcast. Now I'm like, with all my injury patients, this has to go into their well plan, a link to their well plan to the Wellman's podcast. This is something people should know. Should have with them, because they don't get it. They don't, they don't really get it. And I'm not sure, they don't get it from their surgeons or physicians. And I'm not so sure some of the PTs are seeing are actually going into this kind of detail when they come in.
And it lets you know what to expect and then why you should be, your doctor isn't just trying to be an a-hole telling you that you're not going to water ski for the next 6 months. These things are, we're trying to heal these tissues. And like I said, the biggest thing at 3 to 4 weeks, that tissue's at 25% of its pre-injury strength.
And I know some surgeons, the biggest letdown or anger or that comes in with these surgeons are when they have to repair the injury.
Yeah, you should see when the PT caused it and we get to call daddy.
Oh great. Yeah, right.
All right. Well, thank you everyone for listening. Hopefully this helped, and we will talk with you next week.
Yeah. Thanks everybody.